The need for a cardiac health support service, that was identified many years ago.
A country patient, if they'd had a heart attack or had ended up in a metro hospital, they would have typically got a telephone call, probably from one of the cardiac rehab services in Perth, but quite often that would be it.
It means they tend to have their heart conditions become more severe over time. They're more likely to end up in hospital.
We've got about 150 patients that we've seen since October last year. One of the things that patients are have been really positive about is the ease of the telehealth consults. They're quite often quite surprised at how easy it is.
It was great having service locally, save time, not travelling to Perth, really helpful. And they still tell me now, don't hesitate if you've got a problem to call.
They might email me, they might telephone, sometimes they SMS. We really want to keep it quite open for them to contact if needed.
Cardiac rehabilitation has traditionally been very structured in that you discuss certain things with the patient at certain points in time across their treatment journey. With Heart Health Support, we're connecting them to the right people in the right places when they need that support. So it really depends on what the patient wants. And what's important is to figure out what extra help they need and thinking about where the patient lives, what are those services in their local community that we can then connect them to. It is very patient-driven, patient-led and therefore patient-centred.
Patients with a new diagnosis of cardiovascular disease might start on a minimum of 6 medications. That can be quite confronting and difficult. It's been a pretty big life event and might be the first time that some of these patients are really viewing their mortality.
If you have access at that earlier stage, chances are you'll be better, you won't be in hospital as often.
A typical sort of referral pathway will be a patient is admitted to a tertiary hospital in the city. They'll then get referred to the Heart Health Support Service, and then from there I would refer to the community cardiac rehab exercise programs.
I'm Amy, I'm one of the physios here at Narrogin Hospital in Southern Wheatbelt Primary Health Service. The Heart Health Support Service helps to ensure that patients are referred to local services for cardiopulmonary rehab following cardiac events. Prior to the service, unfortunately some patients would have got lost, so this service just ensures that everyone gets access to the services that are available.
The early evaluation information we've got is showing that we're getting to the right people.
The feedback we're getting from both clinicians and the patients has been really positive, so we definitely see the need for it.